So let's begin. Inside the brain. You may not realize this, but in your head, your brain is actually floating in a warm bath of cerebral spinal fluid. And the outside surface of our brain, the cortical surface, is really responsible for mapping and making sense of the world outside. And so if you're in a well-calibrated float tank, not a single photon of light should be entering your brain, which means the entire posterior sector of the brain that's responsible for processing and creating our visual world suddenly doesn't have information coming in. Likewise, the area of the brain responsible for hearing and auditory processing shouldn't hear any outside sounds, except maybe the internal workings of the own body. And so much of what floating is about the body. A large part of our parietal cortex and cerebellum is responsible for creating a sense of our body in space. But when you're floating, there is no space. It's limitless. And likewise, in a well-calibrated float environment, you lose sense of tactile sensation because the temperature is so well-calibrated. The air and the body and the water all match perfectly. And so you lose track of where the body begins and where it ends. Likewise, the areas of the brain responsible for taste and smell also aren't receiving any stimulation. So much of our lives is about movement and speech. The frontal cortex is really about that aspect. And floating is one of the few moments in life where we're not fidgeting, where we're not speaking and moving and incessantly and compulsively engaging in the world. We're just laying still. And so this entire swath of the frontal cortex responsible for planning and executing movements suddenly doesn't have to activate. It goes into a state of quiescence. And let's not forget, the brain is not living in a vacuum. The tail of the brain, the spinal cord, also gets a chance to take a respite. Think about it. Every moment of the day, this poor spinal cord is having to face gravity. And then suddenly, that's gone too. So when I first thought about floating, a little over 6 years ago, as a neuroscientist, I thought, my goodness, what a profound intervention for the nervous system. A nervous system that in modern society is being inundated with stimulation, suddenly finds itself in this most unusual of circumstances. And I thought to myself, boy, all these patients I'm seeing every day with severe anxiety, with severe stress, whose nervous systems are on the fray, hypervigilant, hyper-aware all the time. What would happen in this environment? What would that do for their nervous system?